everybody, this is Shiva Mulankatil, and today I would like to discuss a little more on mental health. Now, mental health being an area which is neglected by most of us, it is not even considered as a basic health. Now, in India, if you go to see, the awareness of mental health is very low, and there may be so many people who are suffering from different illness, but they don't know from where to get help, from whom to talk to, whom to approach. So today I have Dr. Annie with me, and she would like to share, her experience of counseling. So, Dr. Annie, would you like to, share something more about yourself?
Hello, my name is Miss Ami Choudhry and I'm a psychologist and a psychotherapist. I am a practicing psychologist in Virar with a private practice with the name of Mind to Heart Clinic in Virar, as well as I'm associated with a number of psychiatrists in the area as well as certain hospitals in the same area.
So, Dr. Annie, in your opinion, how important is mental health?
So mental health is definitely very important, and it has comparisons with physical health, and it is said that just it's as important as having a fracture in your hand and you would go to a doctor to show it. So mental health is important for various reasons. One is because your emotions matter. Your emotions are like touch me not plants. So if you don't treat them well, if you don't touch them well, if you don't uh, take care of them, then they tend to put themselves back in your cells, and it's then going to be manifested later in many different ways, which is a different topic which will take a long time. But yes, mental health is important.
So, doctor, how important is mental health in comparison to our physical health?
Well, like I said, mental health and physical health are the same. So, just as an individual would go to a doctor because his hand got fractured, he wouldn't say, "Okay, let it be till get well on its own." Mental health is the same. If it's not getting well, if you're not able to deal with your emotions well, or if thoughts are bothering you, it is very important that you seek timely uh, medical help or psychiatric help or psychological help, because then it's going to lead to a state of mind which is going to keep bothering you. So just as the hand which is broken, if not treated, is going to stay like that or is going to have future problems, similarly even mental health, if not treated in the right way, if not dealt with in the right way, can cause issues, can cause problems, and therefore we need to give it as much importance as we give to our physical health.
So, with your experience of different patients, do you feel patients find it embarrassing to take professional help with regards to mental health?
So yes, mental health or talking about mental health does become embarrassing for some clients. However, again, this is very subjective because it differs from person to person. So there are some people who are very open about it. However, there are still some people who are not very open, and there are many reasons for it. The reasons can be internal or external, so it can be because of what is happening around and how people are going to take it, or how judgmental, or how the kind of feeling of being judged the individual might feel, and also the kind of people that are around. Similarly, it can also be internal, their own experiences, how they have looked at mental health themselves. So yes, embarrassment is there. However, the basic underlying issue over there is stigma. So there is stigma, and the stigma again comes because of various reasons. So I think the part where we need to work upon is the stigma, to break the stigma, and to allow the embarrassment to go, which has been a process which almost every mental health professional is doing in their own best way possible. So I think it's always going to be a journey. But yes, I really do hope that with initiatives, with small changes, this is one day going to come when mental health is going to be as a normal conversation as one would have ki, how is your hand, or how is your leg, or are you having fever, I think one day, hopefully and prayerfully, I think one day definitely we will reach that stage of life.
So, doctor, how can somebody analyze their sanity or just know how okay they are or if they are not okay, and when should they approach for any help?
Okay, so how can someone analyze their sanity is a very difficult question, because analyzing sanity, the first step to analyzing sanity is defining sanity. And even though there is a dictionary definition for sanity, everybody can define it in a very different way for themselves when we talk about emotions. So analyzing sanity would be a very difficult question to answer. But if I have to just talk on a general basis, if you are able to manage with your emotions, if you're not suppressing them, if you don't have to distract them, if you know that when you're sad and you're feeling sad, you're allowing yourselves to feel it, and you accept that sadness or any other negative emotion for that matter, try to analyze the situations or the things that are causing you to feel that way, then sanity comes with, with these processes, uh, with these processes together. So it's not like it's a one time thing, it's a process. Sanity comes with a process. So and these processes are defined differently by different individuals. So how can one analyze sanity is a little difficult, but yeah, we can, if people want to approach to a mental health professional about this question, I think they can ask on an individual basis. um, I think the professional will be able to help the person as per their personality or as per their thoughts. Yeah.
So, when does it become important for a person to take help from a professional counselor?
When does it get important to get help from a counselor? Whenever you feel that you need to talk to somebody, but you're not able to get that. Sometimes there are times when you do have people to talk to, but you're probably sometimes not getting that answer back, or you feel that they are not able to help you in the way that they want, that you are looking for. Then yes, probably you can look out for counseling or a counselor. Times when um, you feel that you want an objective opinion or an objective uh, analysis of the situation that you're going through or the emotions that you're feeling, I think counseling or considering a counselor's help would be helpful in that aspect. Basically, the moment you feel that your bottle is filling up and you are not able to empty it on your own, you need to you need to seek professional help for sure. You definitely need to consider that option. However, again, it differs from person to person, because some people's bottles may get full very fast, say by the age of 20, but some people's bottles may get full by the age of 40 for reasons and circumstances, so it's very subjective. And sometimes even if the bottles are full, the person isn't aware of the same. So if there are symptoms like aggression or anger or sadness and the reason is not known, then one should definitely seek professional help.
What can go wrong if timely counseling is not taken? If there is a delay in approaching a professional help?
So I think um, people do survive without counseling. It's not like people don't survive, but there are repercussions, there are consequences. Sometimes there are extreme consequences, there are suicides. Sometimes there are consequences where there is extreme suppression, and individuals um, tend tend to show that they are okay, but they are not, and from within they are burning or they are not okay. So things can go wrong from a completely extreme step like a completed suicide or an attempt to suicide, or if timely counseling, or if when counseling is needed and if you don't take it, then you might just end up, putting your problems under the table, pretending that they don't exist, and that one day is gonna come out in a bad way. So again, that's a completely different topic where we speak about problems under the carpet or problems under the table. So yes, it definitely can cause issues. Not that people don't survive in certain situations, but yes, it can have issues, it can have its own repercussions, and those repercussions can be prevented. So for that reason, timely counseling, I feel, is definitely necessary.
Also, if you could shed some light on the difference between a counselor and a psychiatrist.
Okay, so this is a very good question. So who is a psychiatrist, or what is the difference between a psychiatrist and a counselor? So a psychiatrist is a doctor who has done MBBS and probably a DPM or an MD or further degrees in psychiatry, where they can prescribe medications to you. They will be giving you medications based on your symptoms, based on the things that you disclose to them and the symptoms that you tell them. And the counselor, however, does not prescribe medications. The counselor does psychotherapy, which means that there are certain thought patterns which need to be changed. And sometimes in our just in our normal day-to-day lives, we are not able to do that because there are certain techniques, and these are well researched techniques, which the counselor uses to help you change your thought patterns, change the way you think about a particular situation. And therefore the counselor takes more time in terms of sessions. The sessions last for 45 to 50 minutes, and these sessions more often happen weekly, and depending on the progress, it increases, the gaps increases based on how your counselor is going to feel about your progress and the homeworks the counselor is going to give you. However, when we talk about psychiatrists, they prescribe medications, and then most of the psychiatrists do refer to counselors for therapy along with medications. So thank you, Shiba, for doing this. I think the best part is that we are doing something to let people know how mental health is important and what they need to do to come out, and what they need to do to let mental health be as normal as physical health. So yes, thank you so much for doing this.
Thank you, Dr. Abby, for this time and for sharing your insight with us. And for all those who have watched it till here, in case you have any questions, any comments, any feedback, you can put it in the comment section. We'll definitely refer. And if you have any questions for Dr. Abby, we'll address that. And do like, share, and subscribe this video in case you have really enjoyed or got something better to learn from this video. Thank you.